name's Kerry Jackson and I'm Chief Executive of St Gemma's Hospice.
Morning Tracy. Can I visit us here yet please?
St Gemma's is a hospice based in North Leeds. We provide care to patients who have got a terminal diagnosis and we provide that in the community, in our day hospice, and we've also got a 32-bedded inpatient unit. I really wanted to join the Intersect programme because I wanted to see how we could improve care and services across all of palliative and end-of-life care in Leeds. So rather than looking at things as individual commissioners, individual providers, how could we work together to actually provide a much better, more responsive, more equitable service for patients, for families? And I knew that we could do that, I just didn't know how to do it, and that's why I applied for the programme. So I expected quite a lot of theoretical learning and there really wasn't very much of that. A lot of it was about developing relationships, building relationships with other people on the programme, getting insights into my impact on other people, seeing their impact on me, learning a lot about group dynamics and about the people that we include in conversations and how we empower people and also marginalise them. So I think it was a very different learning experience. It was very different from anything I've ever done before. There was a real range of people from different backgrounds on the programme. So you'd expect there to be health and social care professionals, but we also had people from the police force, from the local authority. And they just gave a very, very different perspective on the way we can be quite insular in the way we look at health and care, social care. And I think they looked at it from a different perspective. They told us that we were often using a language they didn't understand. And if we are doing that amongst ourselves as health and care professionals, presumably that's what we're doing with the general population. And they brought some ideas about different ways that they have changed systems. But also fundamentally they brought their personalities, and I think that was the most important thing, was that each one of us brought our personality, our history, our flaws, our strengths, and it was from that we learned the most. I think I've changed enormously as a leader as a result of the Intersect programme.
Morning Kerry.
Morning Gemma.
Just updating Joe where we are with the admissions.
And probably the biggest change is that I've become so much more confident. So I went onto the programme thinking, who is it who's going to make the changes that we need to see? And came out of it really thinking, well, I'm absolutely one of the people who can make those changes. I think I have really recognised the importance of building relationships. So I spend a lot more time now with other people, building relationships, investing in those relationships as important in themselves. And I spend less time on the task, less time thinking about business plans, financial plans, much more time thinking about people. And also my learning has impacted on the rest of my team, the rest of the hospice that I work in. We've spent a lot more time deliberately building relationships amongst the senior team and the next level of leadership. And I think I've got a team now that feels more empowered to make decisions, more able to take risks and just feeling that they can do the right thing. What should I be doing, and knowing that they can just go out and do it.
We've had a few problems getting their rotas sorted out, haven't we?
Also, we've become a much more outward-facing organisation. So not just me, but lots of people throughout the team are spending much more time out, looking at how other people are working and looking at across the system, how can we do things better together. I think in relation to patient care, hospices have always been a real leader in terms of looking at people holistically and thinking about the needs of the individual. But I still think the Intersect programme has made a big difference in looking not just at the patients that we care for at St Gemma's, but looking at the whole population of Leeds. So in thinking, what is it that we do and how can we do more for all the citizens? How can we reach out with hospice care for our principles to benefit across the whole system? If somebody was considering the Intersect programme, my advice would be that it's a massively challenging programme. Challenging in terms of time commitment, which is significant, but also in terms of personal, emotional commitment. It's not an easy programme to get through. It took all of us, I think, to places we didn't find easy to go to. But I would also say that it's very difficult to develop and become a better leader if you don't explore those places within yourself and become a better person.